Please welcome to the stage Joanna Kempner, Associate Professor of Sociology at Rutgers University and author of Not Tonight, Migraine and the Politics of Gender and Health.
Hi, Joanna. Thank you for joining me.
Thank you so much for having this event.
Well, it's a fascinating topic. I think we're all learning so much. Now, you come to this from a different perspective. You are a sociologist of science, medicine, technology, and inequality. What exactly does that mean?
Well, a lot of people wonder why a sociologist would be studying migraine. It seems like something you would go to a doctor for, and it's true. Please don't ask me to treat your migraine. I'm not that kind of doctor, but I do think that medicine and science are really human practices. Science and medicine and technology reflect our social hierarchies. They reflect race and gender and sex bias and class differences, and in turn, it affects how who gets access to those technologies. I'm specifically very interested in who's believed when they go to the clinic, who's not believed, and who those technologies are made for, and who do they serve best.
So when it comes to, this was something I didn't get to talk with the doctor about, but stigma. I know stigma is a part of migraine disease. Help us understand why some diseases are more stigmatized than others.
Yeah, so I should probably mention what stigma is. So stigma's when we don't treat people like they're human, fully human. And migraine-related stigma is huge. I think the reason why people don't talk about migraine, why they don't tell people that they can't do something because of migraine is because, well, first of all, they're afraid they're not going to be believed. They think that people are that's just an excuse. Mm-hmm. Or they think if they are believed, that people think they should have just powered through the pain. Right?
It's just a headache.
It's just a headache. I had a headache. What, shouldn't you drink some more water? I have some Tylenol.
Right.
And so it's a sign of weakness. And if you're getting migraine with some frequency, as I do, I have chronic migraine, and right now I'm well treated, but when I'm having a headache more days than not, and I tell people, I can't do anything. I can't do anything. That feels bad. People don't take it seriously. If they don't think this is a serious disease, that feels bad. That makes me feel like, people think that I'm unreliable, and that I'm weak, that they can handle a little bit of pain. Why can't I handle a little bit of pain? But the reality is that migraine's extremely painful.
Can you describe it? I mean, for people in the room who maybe have never experienced one or never known someone with migraine?
Yeah, so migraine's typically a one-sided headache that comes with light sensitivity, sound sensitivity, nausea. Some people with migraine have an aura, which is often visual. I don't have that. As somebody who studied migraine for over 20 years, I want to have it once, just to see what it's like. Mm-hmm. I hear it's not very nice. You can have a migraine without the pain, and you can just have the autonomic symptoms regularly. But I can tell you what it's like for me. So as my migraine became chronic, which, I used to have episodic migraine, just occasional migraines. As it became more chronic, the intensity lowered of the pain. Sometimes it's terrible, but usually it's not as bad, but it's often.
You said you can't do anything, so.
Well, okay, that was an exaggeration.
Well, I would say I know that some people, they have to go in a room, they have to close the blinds, they have to shut off the light.
On my absolute worst days, it's like that. But I have a full-time job and 2 kids and 3 pets, and I commute 90 minutes to my job. So I'm doing things, and I think that that's actually true for a lot of people with migraine. We do power through migraine much of the time. I think that's why you're not hearing about people with migraine, because almost 1 in 5 women have migraine. Clearly, people with migraine.
Right.
They're just doing what they can to power through. We're masking.
So maybe they're not trying to get treatment, or are they often misdiagnosed? And does that happen more often with women?
So the misdiagnosis is legion. Only about 30% of people with migraine are even seeking help. Really? 20% are getting a diagnosis, and about half of those, even maybe fewer, are actually getting minimally appropriate care.
That's remarkable.
It's almost unbelievable. Unfortunately, it's true. We have very, very few headache specialists, far fewer than we need. Something about, last I checked, 600 board certified headache specialists. It's not a popular specialty. So in medicine, a lot of times what you practice reflects the stigma of the patients that you treat. And it's perhaps not surprising that clinicians who treat women's diseases, particularly invisible women's diseases that are attributed to the mind, are low status physicians within the specialty. So people who treat pain and fibromyalgia, those physicians tend not to occupy a very high status.
You know, you just mentioned how when your migraine is bad, you know, it's tough, but you're still trying to work and carry on your life. What do you do when we have so many middle-class women and women in marginalized communities who experience migraine and they can't take a day off from work? They can't not show up. And so how do we address that equity issue?
Yeah, so one of the things I have found with migraine is that migraine is widely understood and represented to be a disease that affects middle class or even well-to-do white women. And so I think that contributes to this idea that migraine's an inconvenience. It's a disease that if you have it and you can lay down, then that's great. It gets in the way, you know, the old Excedrin ad, I don't have time for the pain. Well, but sometimes maybe you do, you can go lay down. And I think that for marginalized women, particularly Black women, very much don't even get the privilege of being understood to experience pain, which is an old historical myth that we have associated with slavery. And so it's a population that's extremely underserved.
So how do we address that then?
Well, for one thing, we need to expand access. I mean, with only 600 board certified headache specialists, that's going to be a problem. Many of those board certified specialists aren't just difficult to see, but are quite expensive to see. You need pretty good insurance to go and see them. But I also, because I'm a sociologist, I like to kind of point out some of the social determinants of health. So for one thing, like to be able to go see headache specialists or to be able to go even treat your headache, like you have to have flexible work hours. You have to be able to take off of work. So one thing that
you have to have insurance.
You have to have insurance. Yeah, and that's not easy. That's not necessarily going to be the case. You have to have good insurance. One of the things that we know from research is that there's a lot of what we call presenteeism with migraine. So very often people will get to work, but maybe they're not performing as well as they would have without pain. And you can kind of see this in a reduction in salary. Like people with migraine aren't earning as much, as particularly women with migraine aren't earning as much as people without migraine. And we're not sure, we don't have enough research really to figure out why that is. Maybe it's because they're missing days of work. Maybe it's because they're not being perceived as productive. I can tell you for sure that my career has taken a hit because of my migraine. I'm not as productive. I know I'm not as productive as people who aren't in pain all the time. One thing that I love about my job as a professor is it is flexible. Migraine is unpredictable. So something like flexible work hours would go a very long way in allowing people to go get care and allowing people to treat that migraine and still keep their job. So that's something that I think could help.
Joanna, thank you for your remarks. We're going to have a few folks join us on the stage to talk a little more, go into more depth on this.